Hello, my name is Greg Mitchell, and I'm the Program Director for the University of Tennessee Family Medicine Program here in Jackson, Tennessee. The University of Tennessee program here in Jackson has many strengths. We have a strong curriculum in all aspects, medicine, pediatrics, and obstetrics. We currently have the second highest board scores in the country from the ABFM over the past 5 years, and have an 8-year running for 100% board certification.
My name is Ellie Riley. I'm one of the faculty physicians. So I've been here for 8 years now, coming up right on 8 years. I came directly from residency after graduation and joined full-time. I do outpatient medicine only, and since I started, I really have tried to focus on making sure that we are teaching our osteopathic residents OMT and the use of that with patients in the office, and kind of along the lines of that, the documentation and billing that goes with OMT. I think it's our personal responsibility to make sure that we are teaching our residents how to bill and how to document. Certainly not something that every residency does, but I think it's our responsibility to do so. We have an OMT clinic about once a week that we schedule patients in. Other physicians can refer patients to us, and I work one-on-one with one of the DO residents along with myself, and we see those patients together, we treat them, and then we also walk through the billing and documentation.
The hospital is one of the largest hospital systems in the country. We have over 650 beds in our hospital with 75 adult ICU beds that are all open access. We have a 64-bed emergency room that sees over 100,000 patients. And we're the only residency program here, so it makes it a great site for training you to do everything you want to do in family medicine. Our clinic is very closely located to the hospital system, makes it very convenient for you. We also have lots of amenities inside the hospital, including a Chick-fil-A, a Starbucks, places that we can hang out to have some fun and talk about patients over coffee. We also have a great cafeteria that is sponsored by our hospital system for our residents to get some quick, healthy snacks. We recently added a North Clinic office location to help add adult medicine visits, as well as we've become the primary COVID diagnosis and treatment center for Madison County. So our residents have gained a great experience in learning how to deal with coronavirus here during this pandemic.
I'm Dr. Grant Studebaker. I'm the Assistant Program Director here at Jackson Family Medicine. I've been faculty for 4 years. Before that, I did my residency here. When I first came, I actually had no idea that I'd be teaching. I came up here with the intention of doing our ER fellowship, but kind of just fell in love with the environment and everything here and decided that I really wanted to teach. So the residents work in the MAT clinic with me, helping me see the patients that are follow-up for substance use. And so as part of that, they learn about the medications used to treat substance use disorder, or medications to try to help with the symptoms of withdrawal or manage detox. Not only that, I get consulted quite a bit to manage detox in the hospital from the other providers in the hospital. And so the residents will also help with that. And not only helping with our patients that come in for our service that are in detox, whether it's alcohol or treating DTs or methamphetamine and toxicity or whatever it is. So we do a lot of procedures here in clinic. We do procedure clinics where the resident will work one-on-one with the faculty, and we do pretty much anything you can do in the office. We do vasectomies. We do pretty much any skin procedure, whether it's a biopsy or a shave of some kind of lesion. We do colposcopies or LEEPs for evaluation of cervical cancers. We do IUDs, Nexplanons, endometrial biopsies. Pretty much any kind of procedure that a family medicine doctor can do, we try to do in the office and teach the residents how to do that.
In our 75 adult ICU beds, we have critical care consultants who work with us on a daily basis to teach our residents and help them perform procedural skills. We also run all the codes in the hospital along with the critical care consultants in the ICU, and on the floors, our residents will run those codes by themselves. We have a full-service NICU. We have a high-risk obstetrical doctor, MFM, service here at our hospital, so our residents are allowed to do high-risk obstetrics here. We also have an inpatient pediatric wing along with an outpatient pediatric center called the AIRS Clinic, which is a multi-specialty clinic for which our residents will get some subspecialty training in outpatient pediatrics.
I'm Chris Knight. I'm one of the attendings here at UT Family Practice. I also did my residency here. I took a year and did the ER fellowship, and I came back on as faculty, where I've been faculty here for 2 years now. The ultrasound curriculum is something we kind of started on a couple years ago. We call it POCUS, which is point of care ultrasound. It's a longitudinal curriculum. You do it over the 3 years you're here. We want to make sure you get a lot of good exposure over your 3 years here. It's a bunch of hands-on practical usage We want to teach you how to do OB ultrasounds. We call FAST exam, which is more for the ER trauma stuff, rush exams. So we want to make sure we teach people also how to do ultrasound guided procedures, which you can do in clinic a lot. Like in the hospital, we do central lines, but you can do joint aspirations, joint injections, all ultrasound guided. And all those can be kind of applied to a clinical practice.
One of our greatest strengths here in Jackson is our progressive autonomy. We start you on day one, and that progresses for the next 3 years. That autonomy is obtained through the clinical experiences and the procedural skills that you will learn over the 3 years you're here in Jackson. We want you to become an independent family medicine physician. Our goal is for that to happen before you even graduate, and that the last part of your 3 years here is spent just refining those skills and teaching the residents that are here the skills that you've learned.
My name is Marissa Moore. I'm a second-year resident, and I'm from Greensboro, North Carolina. The training is wonderful. We get to do everything, especially your intern year. You do everything. You do all the admissions. You do all the procedures such as central lines, deliveries, OB triages, intubations. You run codes. So you get to do pretty much anything you want to do if you want to do it. I really love the OB aspect of this program. You do a lot of OB, a lot more than any other family medicine programs that when I was interviewing mentioned to me. So it was really great getting to learn how to deliver, learn how to manage postpartum and antepartum moms. We also do see all of their babies, and it's been cool to see how learning to do those things and now shifting it over to teaching the new interns how to do those things and realizing how much you really do know.
My name is Gautami Sanyal, and I'm a second year, and I am from New York City. I actually transferred here in my first year, and I was at a smaller rural program in Arkansas, and I just really liked everything that this program had to offer in terms of what I could do afterwards. We are a very inpatient medicine heavy program, but also with a really good obstetrics component. One of the best things about this program, I feel completely supported by faculty here. You know, I feel Dr. Mitchell is really just a phone call away. No matter what time it is, it feels like he doesn't sleep. And I just really value all that the faculty have to offer us. They really give you a very good sense of autonomy, and I think that's only backed up by the amount of volume that we see. So the chance to practice your skills and to practice your medicine, but they're kind of always in the background to help out whenever there's needed. And there's so many times I've called my advisor or my faculty member on the weekend just to be like, hey, I just need to run this patient past you and like see what you think. And they're immediately in the chart, you know, they'll look at things and tell us their thoughts. I just feel like the teaching is always centered around you. So it's always like, what do you think is happening? What about this? And it's pretty academic and evidence-based.
Hi, my name's Andrew Aristorenas, and I'm from Adamsville, Tennessee. It's a pretty small town in West Tennessee. And I'm a new intern, so I just started this previous July. No better time than to start during a pandemic, so it's been an exciting year so far. I feel like even though we're a fairly large class, I'm having 12 people per, each year, we all really know each other very well. Like I can name the spouses and the children's names of everybody in the residency program. It's really just like one big family. Pretty much, almost every night of the week there's something going on where we can go to each other's houses, whether it's watching football games, playing board games, or just going out to eat dinner. Everybody really, we just get along like a big family. We know each other, who has dogs, who has cats, who plays golf, who likes to go on hikes and just things like that. Everybody really seems to get along very well.
In addition to the great training you receive here, the culture here is one of the greatest aspects that we can offer here at our program. The culture is such that we will not only help you become a better family physician, but we also want your family to be surrounding you and be supportive of you. We want to get to know you and your family. We want you to know us. We know that this 3 years here, you may be coming from outside areas and not ever been to Jackson, Tennessee before, but we want to make you feel welcome. Jackson is a unique experience. It's a very friendly atmosphere, especially for your family around town. There are many things to do. There are many places to go. The people here in Jackson are extremely friendly, and they want to see you succeed during your 3 years that you're here for the training.
I'm Brandon Churchill. I'm from O'Fallon, Illinois, right outside St. Louis. I'm one of the current third-year residents. I'm actually one of the chief residents here. I chose Jackson 100% because of the training and atmosphere. So complete transparency, I did not intend to come here. I hadn't researched the program at all. I had some family in town, and I kind of came here to interview because it was a free place to stay. And I called my wife after the interview immediately, and I was like, how mad would you be if we moved back? Because she was raised here, and we weren't originally going to come back here, but did end up back here. But why I came specifically, the training is everything. The opportunity is the word that I use. So I was your typical family medicine person where I love relationships. I love people. That's a huge part of why I do medicine. But in equal parts, the science and the medicine is intriguing and exciting for me. And so I thought that this was the best grounds for me to do that. And why I say that is because just the breadth of medicine here is phenomenal. I didn't know exactly what I wanted to do. I used to joke that I was born 75 years late. I would have loved to be a doctor 75 years ago, when you could deliver a baby, then go to the hospital, then go to clinic, and then maybe do a surgery afterward. And that's what I was looking for in medicine, which is so hard to find anymore. And I felt like Jackson, by far and large, gave me the best opportunity to do that. I walked in day one and they started talking about the obstetrics, started talking about the procedures, the open ICU, talking about how you're managing your own patients. And as a second year, you're already starting to run the hospital at times. You're acting as a senior, your second half of second year. Just opportunities I didn't feel like were present elsewhere because medicine's evolving and it's harder and harder to find those sorts of things. But I absolutely felt like this had the most breadth, the most depth, and the personality here was just unrivaled too. Everyone I talked to and spoke to, my interview day, I ended up going to someone's house just to hang out because just the relationship we formed over dinner was so good. So I was here for the interview and then came back for second look and ended up hanging out at someone's house that I'd never met before. And that whole experience has carried over for 3 years for me. So it's that entire experience, it's every part of it. Everywhere I interviewed is unrivaled.
Thank you so much for watching our virtual tour today. We hope we will see you during our interview season. Thank you.